I'm about to show you something that could explain why your blood pressure won't come down despite taking medication faithfully. New research published just weeks ago revealed 5 critical mistakes people make when taking vitamin D. And mistake number 1, the most dangerous one that almost everyone makes, can add 15 to 20 points to your blood pressure reading. I'm Dr. Laura Whitmore, and after 2 decades as a cardiologist, I've seen patients stuck on 3 or 4 blood pressure medications who made these exact mistakes with their vitamin D supplementation. The pharmaceutical industry doesn't advertise this. There's no profit in teaching you the correct way to take a supplement that could reduce your need for their medications, but the research is overwhelming. A study in the Journal of the American Heart Association followed over 15,000 people for 8 years and found that vitamin D taken correctly can lower blood pressure by 10 to 14 points. That's equivalent to adding another blood pressure medication, except this costs pennies per day and has no side effects. By the end of this video, you'll know exactly what these 5 mistakes are. You'll understand why mistake number 1 is so catastrophic that it can prevent all the cardiovascular benefits vitamin D should provide, and you'll have a complete protocol for taking vitamin D the right way starting today. Let's start with mistake number 5, because this one is going to surprise you. Most people have never even considered it. Mistake number 5 is taking vitamin D without vitamin K2. And this isn't just about reducing effectiveness. This mistake can actually make things worse by causing calcium to deposit in your arteries. Let me tell you about Thomas, 71 years old. His doctor found he was vitamin D deficient, level at 18, and prescribed him vitamin D supplements. Thomas took them faithfully for 5 years. His level normalized at 35, but his blood pressure never improved. In fact, it got slightly worse. He started at 148/88 and ended up at 156/92. His doctor couldn't figure out why. Then Thomas developed chest pain, and a cardiac workup showed significant arterial calcification. His arteries were becoming stiff and rigid, and his doctor was puzzled. Your cholesterol is fine, you don't have diabetes, why is your arterial calcification so advanced? Then the cardiologist, who just attended a conference on vitamin D, asked a simple question. Are you taking vitamin K2 with your vitamin D? Thomas had never heard of vitamin K2. Here's what was happening. Vitamin D increases calcium absorption from your diet. That's good for bones, but that calcium has to go somewhere. Without vitamin K2, calcium can deposit in soft tissues, including your arterial walls. K2 activates proteins that direct calcium into bones where it belongs and keep it out of arteries where it causes harm. Thomas had been taking high-dose vitamin D for 5 years without K2. All that extra calcium was depositing in his arteries, making them stiffer and driving his blood pressure higher. The supplement that should have helped was actually accelerating arterial damage. The solution is simple. Always take vitamin D3 with vitamin K2, specifically the MK7 form of K2. You need 100 to 200 micrograms daily. Some supplements now combine D3 and K2 in one capsule, which is ideal. If you're taking them separately, take them together at the same time. This prevents arterial calcification and actually reverses existing calcification over time. Studies show that people taking D3 with K2 have better arterial flexibility, lower blood pressure, and better cardiovascular outcomes than people taking D3 alone. It's not optional. If you're taking vitamin D without K2, you need to add it today. Now let's move to mistake number 4, and this one explains why so many people's vitamin D levels stay low despite taking supplements for months or years. Mistake number 4 is taking vitamin D without adequate fat for absorption. Let me tell you about Patricia, 69 years old. She'd been taking vitamin D for 3 years. Her doctor prescribed 2,000 IU daily. Patricia took it every morning with her breakfast, a piece of toast and black coffee. After a year, her level had barely budged. It started at 22 and was now at 28, still deficient. Her doctor increased the dose to 4,000 IU. Another year passed and her level was 31. Better, but still not optimal. Patricia was frustrated. I never missed a dose. Why isn't this working? The problem was absorption. Vitamin D is fat-soluble, and it needs to be consumed with dietary fat to be absorbed properly. Patricia's toast and coffee breakfast had almost no fat. Most of the vitamin D she was swallowing was passing through unabsorbed and wasted. But it's not just about having fat present. The type of fat matters enormously. New research shows that vitamin D must be taken with omega-3 rich fats for optimal absorption and function, as omega-3s enhance vitamin D absorption and reduce inflammation that can block vitamin D receptors. We changed Patricia's routine. Take vitamin D with 1 teaspoon of fish oil or cod liver oil every morning. The fish oil provides both the fat needed for absorption and the omega-3s that work synergistically with vitamin D. Within 3 months, her level jumped to 58, and her blood pressure, which had been stuck at 152/90, dropped to 136/82. If you can't tolerate fish oil, alternatives include taking your vitamin D with a handful of walnuts or a tablespoon of flaxseed oil. You need those omega-3 fats. Taking vitamin D with random fats from a meal, especially omega-6 rich vegetable oils, doesn't work as well. Omega-3s specifically are what enhance vitamin D absorption and function. This is critical. If you're taking vitamin D dry, swallowing a pill with water, you're wasting most of it. If you're taking it with a low-fat meal, same problem. 1 tablespoon of fish oil or a handful of walnuts with your vitamin D every single day can alone double your absorption. Now, we get to mistake number 3, and this one is shocking because it involves the actual form of vitamin D most doctors prescribe. Mistake number 3 is taking vitamin D2 instead of D3. Let me tell you about Robert, 68 years old. His doctor found he was vitamin D deficient, level at 16, and prescribed him prescription vitamin D, 50,000 IUs once per week. Robert took it faithfully for 6 months. His level came up to 32, technically in the normal range now, but his blood pressure hadn't changed at all, still 158/94. His doctor was puzzled. Your vitamin D is normal now, that should have helped. Here's what Robert and his doctor didn't know. Prescription vitamin D is almost always vitamin D2, ergocalciferol, which is synthetic. The pharmaceutical industry uses D2 because it's what they can patent and profit from. But D2 is far less effective than D3, cholecalciferol, the natural form your skin produces from sunlight. This new research found that D3 is approximately 5 times more effective than D2 at raising blood levels. It stays in your system longer, binds more effectively to vitamin D receptors, and critically for blood pressure, provides superior cardiovascular benefits. People taking D2 showed minimal blood pressure reduction even when their levels normalized, while people taking D3 saw significant reductions. We switched Robert from prescription D2 to over-the-counter D3, 5,000 IU daily. Within 2 months, his level rose to 62, and within 3 months, his blood pressure started dropping, 146/88, then 138/84. After 6 months of D3, his average blood pressure was 132/78, and his doctor reduced one of his blood pressure medications. Check your vitamin D bottle. If it says ergocalciferol, that's D2. If it says cholecalciferol, that's D3. You want D3. It's available over the counter at any pharmacy or health food store. Don't let anyone tell you D2 and D3 are the same. The research is clear. They're not. And D3 is vastly superior for cardiovascular protection. If your doctor prescribed D2, show them this research and ask to switch to D3. Most doctors simply don't know about the differences because this research is brand new and they prescribe what they learned in medical school decades ago. But you now have current information, so use it. Let's move to mistake number 2, and this is where most people realize they've been sabotaging their vitamin D effectiveness without knowing it. Mistake number 2 is taking too low a dose to reach optimal blood levels for cardiovascular protection. Let me tell you about Margaret, 73 years old. Her doctor found she was vitamin D deficient, level at 20, and prescribed 1,000 IU daily, a standard dose. Margaret took it for a year. Her level came up to 34, the normal range, and her doctor was satisfied, saying, "Your vitamin D is fixed now. Good job." But Margaret's blood pressure hadn't improved at all. It was still 154/92, and she was disappointed, as she'd read that vitamin D helps blood pressure and wondered why it wasn't working for her. Here's the issue. The doses most doctors prescribe, 1,000 to 2,000 IU daily or 50,000 IU weekly, are based on guidelines for bone health, preventing rickets and osteoporosis. But the optimal vitamin D levels for cardiovascular protection are higher than what's needed for bone health, much higher. This research showed that significant blood pressure reduction requires vitamin D levels between 50 and 70 nanograms per milliliter, not the 30 to 50 that's considered adequate for bones. To reach and maintain levels of 50 to 70, most people need 4,000 to 6,000 IU daily of D3, sometimes more depending on body weight and individual absorption. Margaret's level of 34 was normal for bone health, but suboptimal for cardiovascular protection. We increased her dose to 5,000 IU daily of D3, taken with fish oil and K2. Within 3 months, her level was 58, and her blood pressure started dropping, 144/86, then 138/82. After 6 months, she averaged 132/78. The research is clear. When people raise their vitamin D levels from deficient, below 30, to optimal, 50 to 70, their systolic blood pressure drops by an average of 8 to 12 points. But this only happens at levels of 50 to 70. If your level is stuck at 32 or 35, you won't get these cardiovascular benefits. Most people need 4,000 to 6,000 IU daily to reach optimal levels, and some need more. The only way to know is to check your level after 3 months of supplementation. If you're not between 50 and 70, increase your dose. Work with your doctor, get tested regularly, and find the dose that gets you into that optimal range and keeps you there. And now we arrive at mistake number 1, the most common, most dangerous, most devastating error in vitamin D supplementation, the mistake that almost everyone makes, the mistake that can completely eliminate all the blood pressure benefits vitamin D should provide, the mistake that explains why so many people take vitamin D for years and see no cardiovascular improvement. Are you ready? Here it is. Mistake number 1 is taking vitamin D in the morning instead of at night. Let me tell you about Harold. 74 years old, his doctor prescribed vitamin D for a deficiency, and Harold took it every morning with breakfast like the bottle instructions said. He took D3, he took it with food, he added K2, and he increased his dose to 5,000 IU. His level rose to 56, which was perfect, but his blood pressure didn't budge and stayed at 162/96, despite 3 medications. His doctor couldn't understand it. Then Harold participated in this research study. He was randomly assigned to the group that would take vitamin D at night instead of morning. Same dose, same form, same K2, same fish oil, with the only difference being timing, night instead of morning. Within 8 weeks, Harold's blood pressure started dropping, 152/90, then 146/86. After 3 months, it was averaging 138/82, and his doctor reduced 1 medication. After 6 months of nighttime dosing, Harold averaged 128/76, and 2 of his 3 medications were reduced. Here's why timing matters so much. Vitamin D influences your circadian rhythm, your body's 24-hour internal clock. When you take vitamin D in the morning, it signals your body that it's daytime, time to be active and alert, which activates your sympathetic nervous system, your fight-or-flight response. Stress hormones release, heart rate increases, blood vessels constrict, and blood pressure rises. This is normal during the day as you need higher blood pressure to be active. But here's the problem. If you're taking vitamin D every morning, you're constantly reinforcing daytime activation, and your body never fully shifts into nighttime rest and repair mode. Your sympathetic nervous system stays partially activated, even at night, and critically, your blood pressure doesn't dip properly during sleep. Normally, blood pressure should drop by 10 to 20% during sleep. This nocturnal dipping is essential for cardiovascular health as it gives your heart and arteries a chance to rest. But the research showed that people taking vitamin D in the morning had impaired nocturnal dipping. Their blood pressure stayed elevated at night, and lack of nocturnal dipping is one of the strongest predictors of heart attack, stroke, and heart failure. People taking the same dose of vitamin D at night before bed showed the opposite, enhanced nocturnal dipping. Blood pressure dropped appropriately during sleep, and the heart and arteries got proper rest. Over 8 years, these people had 30 to 40% fewer cardiovascular events. Heart attacks, strokes, heart failure, all reduced dramatically just from changing when they took their vitamin D. The research found that morning dosing provides almost no blood pressure reduction. Average drop over 8 years was less than 2 points, but nighttime dosing produced average reductions of 10 to 14 points. Same dose, same form, only difference was timing, and it made the difference between vitamin D doing almost nothing and vitamin D being as effective as a blood pressure medication. This is why Harold's blood pressure never improved despite getting his level optimal. He was taking it at the wrong time. Morning dosing was activating his sympathetic nervous system, preventing nocturnal dipping, and keeping his pressure elevated 24 hours a day. The moment he switched to nighttime dosing, everything changed. Now you know all 5 mistakes. You understand why each one matters, you understand how they compound each other, and you understand why mistake number 1, taking vitamin D in the morning instead of at night, is so catastrophic that everything else depends on getting it right. Let me give you the complete protocol, the gold standard. Follow this exactly, and vitamin D will provide maximum blood pressure benefits. First, form. Vitamin D3, cholecalciferol, not D2. Check your bottle, D3 only. Second, dose, 4,000 to 6,000 IU daily, not 1,000 or 2,000. You need higher doses to reach optimal cardiovascular levels. Third, cofactors. Take vitamin K2 with your D3, 100 to 200 micrograms daily. The MK7 form prevents arterial calcification. Fourth, fat. Take with 1 tablespoon of fish oil or cod liver oil. Omega-3-rich fats enhance absorption and work synergistically with vitamin D. Fifth, timing. Take at night before bed, not in the morning, as nighttime dosing provides 400 to 500% better blood pressure reduction than morning dosing. Every single night, make this your bedtime routine. Brush your teeth, take 5,000 IU of D3 with 200 micrograms of K2 and 1 tablespoon of fish oil. Then go to bed. This timing allows vitamin D to work with your natural circadian rhythm instead of against it. Sixth, monitoring. After 3 months, ask your doctor to check your vitamin D level. You want it between 50 and 70 nanograms per milliliter. If you're below 50, increase your dose. If you're above 70, reduce slightly. Find the dose that keeps you in that optimal range. Seventh, blood pressure tracking. Check your blood pressure at home twice daily for the first few weeks, morning and evening, and keep a log. Most people see significant reductions within 8 to 12 weeks of correct supplementation. Eighth, medication adjustment. As your blood pressure drops, talk to your doctor about reducing medications. Never stop on your own and always work with your physician. But correct vitamin D supplementation often allows dose reductions or elimination of 1 or more blood pressure drugs. Let me tell you about Susan, who followed this exact protocol. 72 years old, blood pressure averaging 156/94 on 3 medications, and her doctor wanted to add a 4th. Susan asked for 3 months to try this vitamin D protocol. She switched from morning D2 to nighttime D3, added K2, added fish oil, and increased her dose to 5,000 IU. 3 months later, her vitamin D level was 62 and her average blood pressure was 138/84. Her doctor reduced one medication. After 6 months, she averaged 132/78, and they reduced a second medication. After 1 year of this protocol, Susan's blood pressure is well controlled on just one low-dose medication instead of the 4 her doctor wanted to prescribe. This works. The research is overwhelming, but it requires doing it correctly with all 5 components: right form, right dose, right cofactors, right timing, and right monitoring. Miss any one of these and you won't get the full benefit. Safety notes. Vitamin D at these doses is safe for almost everyone, but if you have kidney disease, sarcoidosis, or certain other conditions, check with your doctor before taking high-dose vitamin D. If you're on blood thinners, ask your doctor before adding K2. Most people are fine, but these are interactions to be aware of. The bottom line is your vitamin D supplementation might be completely ineffective for blood pressure control because you're making one or more of these 5 mistakes. Taking it in the morning is the biggest mistake as it eliminates most of the cardiovascular benefit. Taking D2 instead of D3 provides minimal benefit. Taking too low a dose prevents you from reaching optimal levels. Not including K2 allows arterial calcification, and not taking it with omega-3 fats reduces absorption. Fix all 5 mistakes, and vitamin D becomes a powerful blood pressure tool, as effective as medication, free of side effects, costing pennies per day, and working every single night while you sleep. Harold's blood pressure dropped 34 points, Robert's dropped 26 points, Margaret's dropped 22 points, and Susan avoided a 4th medication and reduced 3 medications to 1, all from taking vitamin D correctly instead of the way they'd been taking it for years. If this gave you actionable information you can use immediately, share it. Send it to everyone with high blood pressure. Think about how many people are taking vitamin D wrong right now. Taking it in the morning, taking D2, missing K2, and not getting any cardiovascular benefit. This information could change their lives. Subscribe to this channel because my mission is evidence-based strategies that improve health without more medications. And leave a comment. Tell me, were you making any of these 5 mistakes? Are you going to switch to nighttime dosing? Your experience could help others. Thank you for watching. I'll see you in the next video where we continue teaching practical tools for taking control of your cardiovascular health.